Welcome to IMCAS TV 10 Minutes with Dr. Stephen Cohen and Dr. Pierre Nicolau, who we will be discussing fillers and complications today. Dr. Cohen, you are the medical director of Faces Plus in La Jolla, California, and clinical professor of plastic surgery at the University of California, San Diego, director of craniofacial surgery at Rady Children's Hospital, surgeon, inventor, businessman, and artist. Dr. Nicolau, plastic surgeon from France, and you have a private practice in Spain as well, I believe. Today, we use a lot of fillers. Hundreds of millions of injections are done annually. Is there one that you feel has never, ever caused any problem?
I don't think any of them have never caused a problem. All fillers potentially can be problematic.
And is there one that creates more complications?
Yeah, this is well proven. Last year at the IMCAS, we produced a survey on more than 300,000 injections all over the world. And the result were that the products that are the more prone are the acrylic gels.
Prone to complications.
Yeah, prone to complications. Now the acrylic gels, silicone oils, the low-grade Centistokes, and the Dermalive. But something that has to be said is the total amount of complication, all product included, is 1.7 per thousand.
Very small.
And the serious complication like necrosis is 4 per 100,000 injections, and granulomas 1 per 10,000 injections. So these complications are terrible, but quite rare.
Right.
And the most important is to prevent and to treat them when possible.
And what are your recommendations to reduce, even if it's a minimal chance? What are your recommendations to reduce or eliminate the complications or prevent them?
The choice of the product first. Eliminate because it's not the time, it's not the duration that seems to be an issue, but more the possibility that the product will disappear, its degradability.
Right.
And not the duration. You have long-lasting fillers that have a long effect, not because they stay long, but because they induce a collagen formations. And I remember dramatic complications with collagen that would last for 3 months.
3 months.
So really, this is the choice of the product, Dr. Cohen.
There's two types of complications, possible complications: vascular and inflammatory. How do you treat each?
Well, vascular has to be treated immediately upon recognition. And if you're using a hyaluronic acid, you reverse that. You have to look very closely at the type of embolization that has occurred. And you have to treat the sequelae by standard means. And these can be very dangerous. But fortunately, even when these occur, they're very, very unusual. And most of the time, they heal in gradually. Nitro paste to dilate the vessels.
Right.
It's rare. You can't really go in and remove permanent filler, which is very unfortunate. But again, these are extraordinarily unusual complications. Inflammatory are different. Inflammatory can occur with any filler. And we don't know the exact root cause. There are certain fillers, like in the United States, Artifil, where granulomas do occur very rarely, again, about 8 in 1,000 patients, and they're always treatable by injections of corticosteroids.
Immediately after.
And you know, sometimes several treatments, and they tend to go away. But in general, prevention is the key. Careful technique, good patient selection, selecting fillers that we know how to manage their outcomes and complications.
Right, right.
Yes, this is true. And as far as vascular complications, I think that a very important point to make to the physicians is the fact that we get much more problems using small gauge needle, 30 gauge needle. really, because if you get into a vessel, you will realize that with a very thin needle. So it's better to use a larger gauge needle, like a 27 or 25 needle, and never inject in large volumes. The boluses have to be small, because then you can get compression, not only direct injection and emboli, like has been shown for the eyes,
Right.
but the compression, local compression of the vessels.
Mm-hmm.
And the risk, including with the hyaluronic acids, because they're very hydrophilic, and then they might increase the local edema. And if it's a zone which is not very expandable, there is a risk of vascular blockade, especially venous return, which is one of the main cause of vascular problem. But they're very rare.
Very, very rare. And it seems to me that sometimes it's not the product, it's the person administering the product where the risk is the greatest. If you have...
It's difficult to say, because we just suppose that the doctors are well trained for this technique.
Mm-hmm.
Injecting a filler is not just like filling a balloon.
No.
A face is not a balloon. It's three-dimensional, very different tissues, a lot of structures, nerves, vessels, muscles, fat, deep fat, superficial fat. All these structures have to be addressed differently. And the progresses in the fine anatomy of the face or the hands really allows us to know much better what we are doing. And this is really a question of formation.
Yeah.
And the doctors have to be really eager to go and search for that, for this new knowledge.
Yes, exactly. And is there a global classification of these products, or even an international registry? Or does each country kind of have their own standards?
As of now, each country has their own standards. I can't speak for the EU, but in the United States, we have only about 8 or maybe up to about 12 approved fillers, so a smaller number. My understanding in Europe, there may be even up to 80 fillers that are approved.
Yes, in Europe, in the United States, the patients are, in that respect, probably more protected than in Europe, where the European marking is just a certification that the product has been manufactured in the proper conditions, but not of its quality. Whereas the FDA approval is a much more serious path and very difficult to obtain. Now, something which is important that people could understand, there are two great types of fillers. One are the volumizers per se, which are just product that will work by the sheer volume which is injected. This is the case with the hyaluronic acid or the gels. You inject a volume and you hope it's going to stay and that it will not provoke any problems, because they're not meant to provoke a reaction. And when and if a reaction occurs, it will be unfavorable.
Right.
And the other great distribution are the biostimulators. Started with Articol Artefil, now with Radies or Elancé, and these products are
stimulating tissue.
Are stimulating tissues. They're designed in an excellent way now compared to product like Dermalife, because they induce a reaction that will gradually stop once the proper collagen level encapsulation is obtained, and then the product will disappear, leaving behind its collagen, its new collagen. So for me, they could be in some ways safer than even the hyaluronic acids, because we see more and more complications with hyaluronic acid, including true allergies, which didn't seem possible. Maybe not to the hyaluronic acid itself, but by the byproduct or the components of the linkage used for the linking of the molecules.
Yeah. So are the longer lasting fillers more risky?
We have not in that respect, because the product will disappear, but the effect will stay for 2 years, 3 years sometimes.
And Dr. Cohen, is there anything that might be disruptive in terms of fillers that you see coming on the horizon?
Well, I think that increasingly there may be a trend toward using fat again. As we've learned more about how fat can be a natural filler and volumizer, how it may last longer than many of the traditional intermediate term fillers and yet still be our own body that we're using.
Exactly, natural.
I think that potentially will be a significant disruption on the horizon.
Well, thank you so much for being with us, and I appreciate your expertise. Thank you so much.
Thank you very much.
You.